compliments of the season to you. Good evening and thank you for joining us on this last edition of NCDC Situation Room in 2018. Yes, it is the New Year Eve. And how are you preparing for 2019? It's barely 7 hours to go. Well, I'm sure 2019 promises to be a better year than 2018, so keep your head high and never lose hope. Also, I hope you have learned ways to ensure you're better protected against infectious diseases in the coming year. Remember, we have talked about a lot of them on this program. Now, as we move into the new year, there is a need to step up preventive measures to ensure that the country is adequately protected against disease outbreaks. My name is Abdul Fattah Otori, and today we focus on ways to reduce the morbidity and mortality arising from hemorrhagic diseases. In this case, we concentrate on Lassa fever. I implore you to please stay with us.
Wetin be this Lassa fever wey dey hear up and down so?
This na disease wey Lassa fever virus dey cause. E dey happen when person touch another person or rat wey carry this virus poo-poo, wee-wee, spit or even blood, and e no dey send age o.
Abeg, how fit take know person wey carry Lassa fever sef?
The sign dey show 2 to 21 days after person touch another person or rat wey carry this virus. Dem fit dey catch cold or weak or get body pain or sore throat or dey vomit plus purge or cough or make their body no dey fit stay one place or make face swell up or make blood dey comot from any part of the body. Person wey get Lassa fever fit be like say na any other disease.
How we fit take stop this Lassa fever?
No near rat, dead or alive. Keep your house plus area clean. Store water plus food where rat no go reach am. No spread food for road or even open place. Dey careful with the person wey get Lassa fever or the one wey Lassa fever kill. Make sure say you follow wetin government talk before you bury am.
Dem fit treat this Lassa fever?
E better make you treat am early immediately you notice am. So no waste time o. Go the hospital wey dey near you immediately you begin get the sign. This message na with Federal Ministry of Health, the Nigerian Center for Disease Control, World Bank Ready Say Project, and UNICEF.
Thank you very much for joining us again on NCDC Situation Room today. As we've told you on many occasions on this program, Lassa is an acute viral hemorrhagic fever, extremely virulent and often infectious. It occurs very frequently in different parts of Nigeria. That's why it's very important to ensure you do nothing that can predispose you to getting infected by the Lassa virus. Strategically, since there is currently no vaccine that protects against Lassa fever, prevention is key. It involves societal and individual behavioral changes hinged on good hygiene. Individuals should learn to store grains and other foodstuff in rodent-proof containers, dispose of garbage far from the home, and maintain clean households. Also, health workers need to maintain a high level of alertness in the wake of the recent outbreak and observe universal precautions in handling all suspected cases of Lassa fever. Well, at this juncture, let's get to hear from our drama group what message they have for us today. When we return, we go to the Situation Room. Please wait for it.
Ha! Hey! Emiomo, Olopa. How can police arrest me? For what now? Let me call my friend Malam Usman. Let him tell his brother at Asovila about this nonsense. Emi. This Olopa does not know who he's dealing with. I'm a very popular person in this community. I will pull your uniform. Let me call Usman. Hello?
Yes? Chibadisa, what can I do for you?
One Olopa just arrested me for overload.
Okay, for overload? When did you start taxi driving? Look, you are now using your car for kabu-kabu, eh?
Otio, no, I was not carrying anybody or any load.
Okay. What is he charging you for? In that case, he is looking for trouble for himself. I am coming now.
Oh, Joe, come quickly.
Chief Adisa, Ogini, what are you doing with the policemen?
I did next to nothing, Dr. Chukwu. Nothing.
That is not possible. They cannot do that now. Officers of the law, what did the chief here do to warrant you stopping him in the middle of the road? Tell me.
Ask him now. We are only doing our job.
Where you? Chibadisa, I am here. I had to run here almost immediately, make a parua. Hope all is well.
Welcome, Malam Usman. Welcome.
Usman, don't waste time. Just call your brother, that AIG. Tell him to come and arrest this policeman and possibly carry them away for disrespecting a high chief of the land.
Yes, Chibadisa, wait first. Before I do that, let me know what they have done.
Oh, Ezioku, that is very true. Let us know what they have done. See them standing over there, calm and calculated. What have they done?
Listen now, that place where they are standing, that is their checkpoint. You see, one of them stopped me and asked me to park, which I did. Then he asked me, he said, are you alone in the car?
What kind of question is that?
No.
Are you driving with demons inside your motor?
Mbano, Malam Usman. What did you tell them, Chibadisa, when they asked you this question?
I said no. Angel Gabriel, Abraham my father, Angel Michael, and all the heavenly hosts are with me in the car. Yes, that's what I told him. That small boy standing over there, do you know what he said? He said, okay, this car is meant for 4 passengers and you are carrying more than 15. That is overload and you are hereby charged for overload.
Can you
imagine?
So how is he wrong? Why are you complaining? They are right now. If you carry all the people you mentioned, that is overload. The only question is how many of them are inside your boot.
Usman?
Yes.
How can they be right? What are you talking about?
Doctor, you are here. You heard what he said now.
You see, Malam Usman, it is good to ascertain the cause of every issue before jumping into conclusion. We health workers, we exercise patience in investigating an issue thoroughly before taking a decision. Imagine if you, Malam, had called your brother, you would have been ashamed of yourself by now.
Can you see? What you have said, doctor, is very true. But if I go to see doctor, me by myself, he will first look at my eye, look at my nose, my mouth, my temperature, my blood pressure, and so on and so forth. I'm telling you, the school is not for nothing.
Thank you.
I do not believe that entirely. Look, okay, tell me, if they are that careful as you claim, how come some of them are victims of lassa fever and yellow fever and even Mr. Ebola?
Well, that's a very good question. Let me tell you, Chifadisa, there is what we call passion. And in the business of saving lives, passion drives it. You see, sometimes you think less of yourself, but just trying to ensure that a life is saved.
Listen, that is the time you have to be more careful.
Yes.
You don't joke with life, Ke.
At all. Look, Chibadisa, you are very, very correct. Yes, because if the doctor come and die, who will treat us now? See all the diseases that are full everywhere. Malaria fever, yellow and black fever, even lassa fever, that even almost made the age-long friendship between me and Adisa collapse.
See, I must confess you are correct. We are now telling every health worker, doctors, nurses, and every one of us to ensure universal protection.
Yes, Magana, but a doctor, how will the health worker know that a particular case is lassa fever, yellow or black fever, or even something else?
Well, that is another very good question. Like a boxer in the ring, we advise health workers to protect themselves at all times and in every case presented to them. No exception. Even you, the community people, protect yourselves.
Lobaton. We should all become Muhammad Ali and protect ourselves. Lobaton.
Splendid message indeed from our drama group there. I sincerely hope you picked a lesson from it. So if you did, go ahead and speak with us about it. You can reach us through Twitter. The handle is at NCDCGov. On Facebook, you can find us using Nigeria CDC. You can also reach us through a toll-free line, meaning you don't pay when you call. The number is 0800-9700-0010. Send us messages only through 0809-955-5577. And we're also on WhatsApp. The number is 0708-711-0839. All right, it's now time to join Godwin Odemeje in the Situation Room. Godwin, what do you have for us today?
Okay, thank you, Abdul. The situation today has to do with cerebrospinal meningitis. We are receiving reports from different parts of the country that there are increased cases of cerebrospinal meningitis. And I have on the line the team lead, Technical Working Group on Cerebrospinal Meningitis, Dr. Olaolu Aderinola. Welcome to the program.
Thank you, Mr. Godwin.
Now, we are hearing reports of cases of cerebrospinal meningitis in the country. Can you confirm this to us in the Situation Room?
So we are in the season in the year when meningitis cases will increase because the temperature has increased, humidity has also reduced. That means quantity of water in the atmosphere has reduced. And also because of the high dose that we have now. So we are in the season where we have increased number of cases of meningitis, which we already know will begin. So from the 3rd of December, that is week 49, we had 14 cases reported from 3 states. And from week 50, that's from 10th December to 16th December, we had 13 cases reported from 3 states too. So we have 27 cases reported since 3rd of December.
Okay, tell us the actual states involved.
Okay, so the states involved, we have Katsina, Zamfara, then Ebonyi. But most of the cases are in Katsina, Zamfara state, followed by Ebonyi state.
So what is NCDC doing right now to curtail it?
So at NCDC, before this time, we had made preparations because when the cases will increase. We've sent letters to the Honorable Commissioners of Health, 8th of November, to make preparations for increased number of cases. We have been communicating with state disease detectives, which we call state epidemiologists, to ensure that all cases are picked quickly and reported to us at NCDC. We've also trained health workers to be able to identify cases and collect samples for testing, which is very critical for us to make confirmation. So this we trained health workers in Zamfara State between 11th and 13th of December. That's one health workers who are trained to be able to identify cases and collect samples for testing. Also on our website, ncdc.gov, we have issued a public health advisory so that the public has access to this to know things to do to prevent having meningitis.
Okay, I was just going to ask about fatality rate.
We have about 3 cases of deaths already reported, and we are working so that we reduce the number of these deaths. Once people come to our health facilities quickly, and diagnosis is made, we're able to reduce the number of deaths.
You are talking about prevention. Tell us more on what NCDC is doing to prevent more cases of cerebrospinal meningitis.
Okay, so the prevention for meningitis now is about getting everybody involved. So for us, our message is that we should avoid overcrowding and ensure there's adequate ventilation in our homes. The other thing is when people cough or sneeze, they should cover their nose with disposable tissue, or they could just cover into their elbow, and they should make sure that they wash their hands frequently, especially after coughing or sneezing. And if there's any symptom, they should report to the health facility quickly. And also for our health workers, we always encourage our health workers to ensure that they are practicing universal precautions, to ensure they are wearing gloves and handling patients well so that they too don't spread the disease and they don't come down with meningitis themselves.
Okay, before I let you go, Dr. Aderiola, did you say a lot has been sent to other states of the Federation? As we all know, it is not just states you mentioned are affected by the season.
Yes. In Nigeria, we have 25 states and the FCT in the meningitis belt. So most of the states are in the northern part and a few in the southern part of the country. So this was sent on 8th of November to all the commissioners. Because as NCDC, we cannot do this alone. We work with our states, and our states are helping us to ensure that we can control this together.
Okay. The team lead, Technical Working Group on Cerebrospinal Meningitis, Dr. Olaolu Aderiola, thank you very much for speaking with us on the program.
Thank you so much, Mr. Godwin.
All right, thank you very much, Godwin, for the update. Now it's time to meet my guest on today's edition of the program, NCDC Situation Room, and he's no other than the Chief Executive Officer and the National Coordinator of the National Center for Disease Control, NCDC. He is Dr. Chikwe Ihekwazu. Thank you very much for joining us on today's edition of the program, sir.
Thank you very much.
Now, Dr. Ihekwazu, 2018 has been a busy year for NCDC. It's also a year where it appears the level of response to disease outbreaks has been really commendable. This is evident with the way the center has responded to recent outbreaks, especially that of lassa fever. But tell us, we're in reporting week 51 now. How well are we doing in terms of Lassa fever cases?
Yes, we always have a trickle of cases throughout the year. You will see on our website, we've been very proactive in sharing these cases. Every week, we provide an update on the number of cases. We have a very good system now. There's almost no other disease for which the surveillance is as good as Lassa. Once the cases are detected, we have a mechanism to report, a mechanism to support the states in the response. They can get help both in clinical management, risk communication, all aspects of the response is very well coordinated, and we're really preparing for next year to ensure that we do even better in managing cases as they arise.
All right. Now, let's talk in terms of predisposing factors to this infection. How well are we doing in terms of prevention?
Yeah, so you see with Lassa, there are two primary ways of transmission. One is what we call spillover events from rodents, from rats, where rats have access to foodstuff that humans ultimately will eat or drink. So the first key message is preventing access to food at homes to be infected by rat excreta. The second mode of transmission is when there's actually an infected individual who then transmits to another. And the people most at risk are family members caring for ill patients or healthcare workers caring for ill patients. So the healthcare worker transmission is actually easier to prevent. The biggest challenge we have are rodent transmissions, because transmission from rats to humans, there are many factors leading to that. It's socioeconomic conditions of where people live, overcrowding, sewage, the things that attract rats into homes and all of that. So it's very complex to completely eradicate and not entirely in the hands of the health sector. So we continue sending these messages. Going back to the point you made, next year is 50 years of the detection of Lassa fever. Last year, we were very aggressive in increasing our understanding of the dynamics of Lassa fever. We're doing a lot of research, both in animals and in humans, and we're publishing in very popular journals around the world in the scientific community. What I'd like to say here is next year in January, we're hosting a big Lassa fever conference, bringing the entire scientific community together to look at what we know about Lassa, what the gaps are, and to define the research priorities for Lassa moving forward.
All right, now, 2018 saw a number of medical personnel coming down with Lassa fever, and some of them even died. For example, as at week 49, 44 healthcare workers have been affected since the onset of the outbreak in 2018, with 10 deaths in Ebonyi State alone. What would you say is responsible for this?
You see, it's a complex challenge. It's easy, but it's still complex. The doctors that pass away, the most likely to be infected by Lassa, are often those that work the hardest, that put themselves in harm's way because they want to help patients. So you see a patient come in, sometimes gloves are not immediately available, and the one doctor that goes in and says, listen, I'll help this patient, is then infected. So we have really worked very hard with FETA in Abakaliki to make sure that the hospital itself sees the importance in investing in PPEs. I mean, the most important one are gloves. The others you can sometimes manage without. We always encourage universal precautions all the time, because it's that one time that you don't use it that you may get infected. But the one thing patients too should look out for are gloves. And we're also telling patients, if a doctor comes to examine you without gloves, you have a right to say, please, sir, or please, ma, please put on your gloves. So there are a lot of cultural issues that prevent us from having informed dialogue with caregivers. But I think we're breaking these barriers, bringing a culture of infection prevention and control, encouraging each hospital to have its own IPC committee, have a group of colleagues that hold themselves accountable to making sure that they are ready. So yes, it was quite a tragedy in Abakaliki last year, but I can say that I think Abakaliki has really worked very hard in the last year, and I'm really hoping that in 2019 we will not see healthcare worker deaths in Abakaliki. That is really our objective with our hospital.
How about those who are not healthcare workers, or generally, how do we prevent this from happening?
At home, it's a disease that is actually very preventable. What we want to inform people about, listen, lassa is transmitted when rats have access to foodstuff that humans will eat. Now, how you prevent that? If you're able to pack your food away from rats altogether, that's great. So we're not going to be prescriptive and saying this is what you must do. You must put it in a refrigerator. Of course, if you have a fridge, that's perfect, but many of us don't. So the key thing is people need to understand that this is caused by contact between rats and humans. Now, do everything possible to prevent that happening. The best way is preventing rats from coming into your environment. Now, if your house is clean, you don't leave food lying around, it's unlikely that rats will find your place attractive. So the first thing is really for people to understand that if you can prevent contact from rats to your foodstuff, we've really gone a long way in preventing the potential of lassa to spread.
Indeed. Now, I've really looked forward to asking you this very question. So, is not eating bushmeat a way of preventing one from getting infected with Lassa fever?
The problem with bushmeat is not in the eating of fried bushmeat. It's in the preparation of bushmeat. It's in touching these animals, cutting them up, playing with their blood, turning the meat around. That's where the biggest risk is. So if I am buying, I am not at risk. If I am buying cooked bushmeat, if I am the one cutting the meat without gloves, without taking precautions, yes, of course I'm at risk. So the key thing is to communicate this. So if you have to prepare bushmeat, you have to adhere to universal precautions. Gloves are not only for doctors. You can buy those gloves yourself and disinfect as much as possible, but use gloves and then sell. So the challenge really is if you go to a lot of our markets, not just for bushmeat, where we sell all sorts of meat, you see the hygienic conditions are very bad. And really that is where the risk is. It is not in the individual going to buy and eat prepared meat.
All right, that's a relief. At least I know now that I can eat my bushmeat in peace. But still on individual protection against Lassa fever, let's talk about how we handle the dead around here. A lot of people have used culture as excuse to break the safe burial instructions, which could be fatal if the individual died as a result of viral hemorrhagic fever. How do we handle this as Africans with deep-rooted culture?
Lassa and a few other viral hemorrhagic fevers. In this difficult situation that the corpses are actually a big risk factor for the living. The reason is not that the corpse itself is a problem, it's the handling of that corpse. So very often in many cultures, we wash the dead, we prepare them for burial, we touch them, all sorts of things. Whether it's part of religion or culture, it depends on where you're from. The truth is this is a big risk factor for those alive. I think when you're already burying someone, you don't want to bury more people. So the key thing is if we make a diagnosis of Lassa or any of the other viral hemorrhagic fevers, we have a process of safe burial that allows you to still carry out your culture without putting yourself at risk. So please listen to advice of the healthcare professionals. Don't really play and touch the dead as much as possible, even when you don't know the cause of death, because sometimes it may not be obvious that this person actually died of Lassa fever, and I think this is good practice all through. However, if we do know, then every state we have a safe burial team that can advise you on a safe burial for your dead.
But then someone may ask, if Lassa is same family of disease with Ebola, they're both hemorrhagic fevers. So if we could defeat Ebola, how come we haven't been able to defeat Lassa for almost 50 years?
This is a very important question for people to understand. That these two viruses, even if they're similar, they have one critical difference. Most cases of Lassa fever come from multiple spillover events from rats to humans. Most people get infected from rats. There's occasional human-to-human transmission. but most infections are from rats. Ebola is different. It's mostly one single transmission from an animal that we don't even know for sure yet to humans, and then every other case is human to human transmission. So if you can break the chain of transmission, you basically will stop the outbreak. And that's really what we did in Liberia, Guinea, and in Nigeria. But in Lassa, because there are multiple sources of introduction and the virus is endemic in rats in our community, unless we can find a way of eradicating rats easily, it's very difficult to stop outbreaks the way we stopped Ebola. So understanding that these viruses are all slightly different, have different host animals, understanding how they interact with each other is important in defining a response strategy. So one important thing we're doing this year as well is working with our colleagues in the animal health side. This is not an issue that we can solve on our own as medical practitioners. We need to work very closely with our colleagues in agriculture, in animal health, to understand transmission in animals and to stop transmission from animals to humans.
All right, as we round off this discussion, I know your center is also leading the response in the West African region. Now, going into the new year in just a few hours, what exactly would you be looking at?
So I think for the first time in a long time, Nigeria is really showing leadership across the region, and all the other countries are really looking up to us. No other country provides this level of analysis, is doing the research that we're doing, pushing hard on all frontiers around Lassa at the moment. So if you ask around the region, they really respect the work we're doing in Nigeria at the moment. They're looking up to us for leadership. Many of them are coming for the conference in January to learn about the work that we're doing. We're encouraging a lot more people to come. I think for the first time in a long time, we can all be proud of our work on Lassa. The challenge now is how do we replicate this to all the other diseases that threaten our existence and make sure that we have the capacity to prevent, detect, and respond to all infectious diseases all the time so that Nigerians can sleep well at night.
Well, I must say a very big thank you to you, Dr. Chikwe Ihekwazu, CEO and Coordinator of the Nigeria Center for Disease Control, NCDC, for speaking with us today. And we wish you success in all your endeavors in the new year.
Thank you very much.
And that's the size of the program NCDC Situation Room today, the last for the year 2018. We thank you for being a part of the program. Hope you will do more with us in 2019. But if you want more explanation on what you have heard today, please reach us via Twitter. The handle is at NCDCGov. On Facebook, it's Nigeria CDC. You can also reach us via a toll-free line. The number is 0800 9700 0010. Send text message only to 0809 955